Hello, everyone, and thank you for joining our first webinar in a series of global conversations about transforming telecare. My name is Patty Wynn, and I am Tunstall's Chief Health and Care Strategy Officer. I'll officially start the call at around 10:01, and while you wait, please complete the poll on your screen. Your cameras and mics have been muted, but we'll have live captions enabled via Microsoft Teams, so please do use those by changing the caption language, but make sure not to change the speaker language, as the webinar will take place in English and it will be recorded. Today, we are joined by 3 distinguished panelists from across Europe who are leading the way in transforming telecare. Our goal is to foster a dialogue that encourages cross-border sharing of ideas while acknowledging the uncertainties and challenges we face in the industry so we can navigate them together. We encourage audience participation throughout the session with a series of polls and then a Q&A. Please feel free to submit your questions or comments using the Teams platform as we go along, and then we will moderate questions from the audience at the end of the call. So let's get started. We're joined today by Laurent Wenric, who's a Managing Director of the Centrale de Services à Domicile, CSD Liège, in Belgium. Laurent's expertise is community-based care services, and his innovative approach to telecare will provide valuable insights into the future of the sector. Next, we have Kevin McSorley. He is head of Radius Connect 24 Radius Housing in Northern Ireland here in the UK. Kevin has been instrumental in delivering telecare and telehealth services across Northern Ireland, focusing on enhancing the quality of life for vulnerable populations. And finally, we're joined by Dan Kax, who's Chief Officer in charge of Welfare Technology and Digitalization, Jönköping Municipality in Sweden. Dan leads transformative initiatives in welfare technology, significantly advancing digitalization within public sector services in Sweden. So let's get started. Personally, I'm a big fan of starting with why, and so I'd like to start there and hear from each of our panelists. Starting with you, Dan, can you describe your organization's vision and mission and what your aspiration is for the end users you serve?
Of course, but first and foremost, thanks for inviting me to this panel discussion. It's an honor to represent Jönköping and Sweden. I can start with our vision. Our vision is mainly to address different needs within the target group, and the target group within the social services, it's elderly, it's people with function variations, and of course it's people with or it's also the contributions towards children, family, and youth. And the main goal, I think, is we want to maintain integrity and self-independence as long as possible. And with that being said, at least towards elderly and also people with function variations, we mean that in the terms of being able to remain at home as long as possible. And here it's also interesting to see to gain perspectives from around Europe and the world. There's no need for us to discover the wheel if someone else has found it, so to speak. And what else? We are also trying a vision that is being implemented from now on. We want that the digital solution should be the first option in caregiving when applicable. And from the others, from Kevin and from Laurent, I think I would gladly discover or gain new insights and perspectives from fellow Europeans. What are the challenges and solutions that they are seeing from their point of view? And it's also interesting to hear, how is the adaptability towards technology in other countries? How is it experienced within their cultural context?
Great, thanks, Dan.
My introduction. Thank you.
Perfect. Thanks for joining. And with that, we'll hear from Laurent and Kevin as well. Laurent, do you want to take it next? What is your organization goal, the vision, and especially that vision for end users?
Okay. So thanks for the invitation. My organization is CSD Liège. It's a non-profit organization. We have more or less 1,300 workers. And our goal is, simply said, making sure that people can stay at home in the best possible conditions while being too old to live by themselves or being disabled or in difficult situations. And we provide a wide range of services: caretaker, nurses. We do also food delivery. We lend some medical devices and so on. Basically, we try to have a wide range of services to make sure people can stay at home. And we also have this Telecare solution that is of course quite useful for people when being home. And we are currently trying to work on, I would say, next generation of Telecare and testing solution with artificial intelligence to go from reactive solution to more proactive solution and try to avoid problems before they come than just trying to solve problems, because we know that the sooner we can intervene, the higher the chances are that we can have a better solution for the persons. So basically that's our why, I would say, and I'm really excited to be here today.
Yeah, that's great to hear. That's my personal mission as well. So Kevin, I'd love to hear from you. I know we've spoken a lot about that in the past. How are you thinking about that future within Radius in Northern Ireland?
No, I'm delighted to be here. So Radius is the largest social enterprise in the island of Ireland in terms of a housing association. So it's providing over 13,000 homes to people, but also supporting an additional 20,000 households through our Radius Connect 24 personal alarm service. I mean, the aim is to improve lives and communities, supporting people to maintain independence, dignity, and quality of life. Firmly believe everyone is entitled to a place they can call home that is safe, secure, and affordable. And we will enable people to live with dignity and contribute to the community for as long as possible. Already, we can hear that the challenges and opportunities for the tech sector are shared across nations and jurisdictions, both in terms of the demographic challenges, but also the transformation opportunity offered by tech. And I'm really keen to learn how we can bring a sense of urgency to realize the opportunities which are offered by tech, because we have solutions out there, but it's the widespread mainstream adoption of those solutions at pace to deal with the challenges we have.
Yeah. Well, thank you all for joining. I think I really am thrilled to work at Tunstall. I've been here about 18 months now because we get the chance to see the commonalities between those different regions that we support. And what really strikes me is that commonality of trying to keep people independent, trying to keep people in their homes, really enabling them and thinking about how to shift from reactive to proactive. And I think that's really in line with Tunstall's vision, which is to have a world where people have the freedom to live life in the place of their choice. But as Kevin was just mentioning, there's a lot of transformation happening in the industry. And I think that, we see these two kind of dynamic trends happening across the industry. First is just the demographics. We know baby boomers are entering their 70s, and therefore the amount of people that we need to serve is rapidly increasing. And that's really difficult for the wider health and care service to keep pace with that demand. But at the same time, not only in our industry, but in all industries, we see technology rapidly evolving, whether that be kind of the foundations of telecare moving from analog to digital telecoms networks, or all of these next generation technologies, artificial intelligence, the Internet of Things, generative AI. And so I think this transformation is really about how we navigate those forces together. And so I'd love to hear from each of you on that. And starting with Laurent, how do you think these forces are really influencing the future of telecare and your organization? And how do you think technology-enabled care needs to evolve to help realize that vision you have? And where do you see the most room for innovation?
Well, I totally agree with the two trends that you mentioned. My vision is that technology in our sector should be serving the people and not the other way around. And I think that's probably the first and more crucial element if you wanted to succeed with your patients, but also and especially with your workers. Because I mean, I think the three of us around the table are working in non-profit or public sectors, and you have workers who are really concerned about their patient, but also concerned about their lives. So my first thing when I talk about technology is really explaining that technology is there to help the caretakers to bring a better care that instead of replacing the person.
Mm-hmm.
The chance that we have is that patients, the number of patients will be increasing. We have a limited number of workforce because we don't have an extended number of caretakers. So people are not afraid of losing their job because of technology. Might seem a bit stupid, but it is quite important because most of the time when people hear about technology, they think, okay, oh, technology is going to replace me. Here they know it's not the case. So that's one good thing. But they need to understand that how is it going to help me being a better worker? So that's really how we see it. I mean, at our place at CSD, technology is not in the heart, in the center of our approach. It's more like an additional tool with our workers and our patient in the center. So we kind of use our workers as ambassador for technology, because I'm convinced that if they are themselves convinced that it's good for their patient will listen to them and will be more inclined to, okay, might be useful for me. I won't feel spied. I won't feel someone is looking at me. I have my privacy and so on. So it's making sure that all the workers are convinced and see how it helps, and also making it concrete and easy to understand. I mean, myself, I don't even understand how AI works. I don't know how it works. I mean, to me, it's still a kind of a black box. I know the outcome, but I don't know really precisely how it works. But we need to be really concrete and explain things. And once people understand, usually it goes smoothly. I mean, of course, you have technological risk and so on, but that's something that you have with every project that you carry on. So that would be my first and most important aspect on that.
Great. And you mentioned earlier that you were doing a bit on AI already. Can you describe more what you're doing?
Yeah, so we used to work, and we still work with like the famous, I would say, red button that people have around the neck, and they push on the button if something happens to them. Now we are working on I would say a wide range of small captors that we put in different rooms of the persons, and those captors will record, I mean, virtually record what's happening in terms of movements, in terms of lights, in terms of temperature, and they will deduct on how the person live, and if they see that there are significant changes in the way the person live, they will, I would say, send an alert in our call center, and so we'll try to understand what's going on. And the strength that we have is that most of the time, we don't only have the red button at those people's place. We have also caretakers who work there a few hours a week to help them in their usual lives. So this alert will be taken by the caretaker and say, okay, oh, we've noticed that you don't open the fridge as much as you used to. Is there any problem? Or you don't go to the bathroom or that often? Oh, maybe that's because we need to adapt your place because you're afraid to fall in your shower. I mean, I'm just things like that, but this is really how we want to use it, using the technology to be able to get something out of it and provide a better solution to our workers and of course the patients.
Great, thanks, Laurent. And I think maintaining that kind of core critical path with the red button, which I'm glad you mentioned, but obviously thinking about how to augment that and balance kind of that criticality with moving from a reactive system to a proactive system using data. We certainly are kind of working in partnership to understand how we bring those worlds together, because we certainly see the value in that. So thanks for sharing. Dan, would love to hear how you're thinking about this in Jönköping and how you think technology will help you and your teams.
But it was a perfect example from Laurent there, where IoT could be used detecting deviations and how to conceptualize that towards care and home care. And I also, to start with, I agree on both the perspectives. Tech is evolving rapidly, and we also have the challenge with the demographics here in Sweden. One force that could be helpful for us here using more technology is that I think staying independent is a force of nature for all humans. So we need to keep that in our minds going forward. But also I think that finding new technology that can be used in care situations, that's not the tricky question. The trick is to how can we transform people's minds to both for the people that needs help and for the caretakers. I think we need to humanize the people's feelings about new technology. To be able to how do you say give that the same amount of respect, so to speak, as the regular processes and routines where a human helps a human, so to speak. It's also, of course, important to see that technology is a complement. It won't take away our jobs. That won't be an issue. What else and I also in these terms we need to become better at nudging. How can we speak in a positive way about the technology and the things that the technology can address. From another point of view, I think we need to find cost-effective solutions that can be integrated into our digital ecosystems. We need to address that in a way so we're not constantly growing with new platforms of technology, because that will be an issue. Yeah, and obviously I think we need to address more support both to the personnel and the end user in order to achieve this vision going forward.
Thanks. I think that point you make, I'm so glad you brought up, if it's not just technology for technology's sake, it's about really technology being an enabler of a new model of care, whether that be nudging the person in their own home to do things, or supporting kind of care teams and care workers or the call center staff to do something in a different way. I know, Kevin, you've been thinking about that within Radius, and I'd love to hear, what outcomes are you really looking for when you think about moving from reactive to proactive, and what are those pilots and projects that you're already working on to make this shift in Northern Ireland?
The first thing to say is I love the word nudge from Dan, because I think it describes perfectly how we can be a support service rather than some prescriptive service, and to me it's not so much about a move from reactive to proactive as a development building upon existing framework of very successful tech services which exist throughout the UK, which have provided such expertise in managing acute demand and crisis management. So it's taking those core skills and competences and the trust and confidence of those clients and doing that bit more to get further upstream. Let's remember that timely responses to things, even in terms of falls management, always enables better outcomes. So it's getting earlier, quicker intervention, but the key to me is keeping the service model simple. I mean, Lauren mentioned the use of sensors in the home to track motion and movement as an indicator that something may not be okay, and to inform the care network. I mean, in our case, very often the informal care network, the unheralded workforce, which don't really get credit they deserve, and they're going to be even more valuable going forward. So we add to the safety net we've got those sensors which give an earlier indication of risk and give the choice of earlier intervention and support. Add to that simple things like proactive daily automated support calls that allows people. So if you're proactive asking someone are you okay? Rather than waiting for them to tell you that they're not. That's a big development. It allows a person to request a simple follow-up call. So we're building trust and confidence with service users and their family. We're taking that step further, and we're really addressing the latent challenge, which is also not spoken about very often, of social isolation, through trying to empower clients and support communities to become self-supported almost as far as is possible, and so maintain that independence for longer.
No, I think that's so important, thinking about the whole person, right? And what ways, I think, especially in care industry, we have that person in the center. And it's one of the reasons I made the shift from health to care, is because we can think about that whole person and think about what actually keeps them independent. And I think loneliness being a great example. I know we all have those examples of, people using Telecare as a way not just to get emergencies, but to actually be a part, connected, right? And how can we actually enable that connection that keeps them independent when they are kind of isolated, I think is so important. But that has knock-on benefits for the service, right? I think you all mentioned a little bit in the earlier bit, technology is about enabling our teams to give the right care to the right people at the right time, because the way the world is headed, we know that the most valuable asset we all have is people, and we don't have enough of them to go around. And so how can technology really help and support? Anything from the other panelists? We're going to do another poll, so just kind of thoughts, comments, reactions to each other.
I think my takeaway is nudging for the moment. I agree with what Dan said, so definitely.
Love it. Let's figure out how to nudge. And I think that's a really good one because, one thing end users probably, I think Laurent and Dan both talked about that fear in the beginning. And the fear of technology is that they're watching and that it's intrusive. But if we can think about it from a nudge perspective, we think about how to make technology as natural as possible. How do we incorporate it into what we're doing rather than it being something that's really burdensome or really scary? So I agree. I really like that concept of nudging. And so we mentioned throughout there is 3 experts on this panel, but I would say that everybody on the call is an expert in their own right. And the goal of this conversation is really to facilitate a dialogue. And we'll do that both through polls and through the Q&A. And so in the meeting chat, you'll have seen the poll from earlier, and you can hit more. And that was some of the results around what is the vision for the future transformation of Telecare. And it's a word cloud, so it kind of shows you what are some of the things that are common. And I think the thing that strikes me is people and independence being the core. And I think you heard that from all of our panelists as well. We wanted to have another poll, so if we can launch that, and really kind of what technology advancements do you think will be most impactful and enable the shift to proactive and preventative care? You've heard some innovations that our panelists are interested in, whether that be sensors in the home or thinking about proactive automated calls. But we'd love to hear from you. What are the things that you're most interested into incorporating to realize that vision of being independent for as long as possible? I'll take a second just to watch these come in. Yeah, I think some commonality here. I think, what's really interesting about the era of technology that we're in, and a lot of my background is actually in data and analytics and kind of person-centered care. Both the Internet of Things and the sensors enable us to capture more data, but then AI and data, machine learning enables us to make sense of the data. And I think that there's a real risk in having too much data, right? And not knowing what to do with it. So what is really exciting about the time that we're in is being able to make sense of the data, because the data is only as useful as somebody, whether that be an end user, a call center operator, or a care worker, or friends and family, can actually do something differently as a result. Otherwise, we're just truly watching people. So it's good to see that commonality. But I think, there's how do we really make this work in the real world is the next chapter of the discussion. And so I think the first part of that is, I think, Dan, you mentioned the need to be cost effective, right? And I think that for a long time, our industry has looked relatively the same. But a lot of this technology is being incorporated from a consumer perspective. And how do we think about bringing that into our industry? We really do need to think about how we fund it, right? It's a lot of new different technology. It's different kind of models of doing things. And oftentimes, we know the impact that care and proactive care can have, but the benefits from a health and care system perspective are often found downstream. So for example, the health service is saving money by reducing unwarranted admissions, but the care sector is the one that is looking to fund this innovation to enable that independence. And we hear from lots of our customers that is a challenge, but it's one that around the world, I think systems are quite aware of. Actually, just last week here in the UK, the new Prime Minister kind of made a speech, and the three kind of key things that they were interested in is how to move from analog to digital, how to move from hospital to community-based care, and how to move from a reactive to proactive model of care. So I think the good news is people are recognizing the opportunity ahead, but obviously on the ground, that sometimes is more challenging. So starting with Dan, especially because you're in the public sector, I'd love to hear, how are you thinking about funding these types of new innovations? What do you think you need to have to justify the investment? And how can we as kind of an industry help shape that to kind of enable those business cases to go through?
Yeah. Well, to start with, I think at least here in Jönköping, that might not be the case in different other municipalities around Sweden, but here the politicians and the workers are well aware of the demographic challenge. So addressing needs is generally not an issue. We can attend those questions in the regular investment processes. So basically, anyway, historically, that hasn't been a challenge here in Jönköping. Another way of funding is government grants. That's also a source to fund these technology implementations. In Sweden, we can also see the trend that you mentioned about Great Britain. There is a proposal now to change the Social Services Act. Not in a big way, but in a way more preventative take, and there is also more focus on availability, not particularly digital availability, but that's also included in the availability perspective. And this proposal, if taken, might also generate new grants. Other issues that maybe it has been not totally sorted out, but historically there has been procurement issues in Sweden with lots of lock-in effects. So during time, it's difficult to address different changes or different development needs along the length of an agreement. So I think that's one issue I think it needs some more attention, but it's better now than it was 5 years ago. And as you mentioned, Patty, and I said it earlier as well, back to the solutions, they need to be scalable and cost effective. The public sector in general is not that wealthy. So, but if the solution is cost effective and addresses a different range of needs, there is money to find for the purpose. The tech needs to be user friendly, of course. We were into that perspective, both for the end user and the personnel. In general, I think that at least here in Jönköping, but I think in other Swedish municipalities as well, the digital maturity among the personnel is not that high. they are used to using their apps in their private phones, but using different and new technologies, it's more difficult than you might think. So I think that's an issue that needs to be addressed, and I think we're in it together. So both the industry and we as public sector need to address these challenges. And one way of doing that, I think, is to establish partnerships between the public sector and the industry, so we can together bridge the gaps that needs to be addressed. I spoke about nudging earlier, and I think that's it's a great word to use, and it shows the vision and the focus we need to address. And I think we need to address that both on macro and micro levels, so to speak. I see a hand raised here, Kelly.
Keep going, you're good.
Okay. And in general, I think we need support in change management. We have resources for that, but not to the extent that that it should be. So we can attend the onboarding process is kind of long in today's work, and I think here's also a perspective that we could team up and work with together to shorten the onboarding processes. And a key for success, I think, is I mentioned it, that we're in it together, so we need to team up on both sides. So that we in different projects, so we allocate the right amount of resources. And I also regarding the procurement perspective, I think we as a public sector needs to be better to embed innovation as a part of the agreement. That's usually hasn't been made to that extent needed here in Sweden anyway. So we can address the issue of the system needs to grow with abilities during the length of the agreement. And also a key factor, I think, is keep your focus on solutions rather than who to blame. There is a lot of tech infrastructures involved in these processes, and it's a complex thing. And I think often as a public sector, we don't understand that complexity. And also to sum up it, I think here in Sweden also we tend to think that technology is the answer to everything. But if you ask me, no, it's not. But it gives us opportunities to organize us in a proper way to be able to gain effect, of course. But I also think that the organizational aspect needs more attention. We're speaking a lot more of it now, but I think we need to talk about it even more. Along the way, I don't think that the digital transformation is suitable to implement all across the actual organization of the social services, but rather in a way in a complementary digital organization where digital first can be applied in a different way. I don't think the new process is suitable for all the personnel.
A lot in there. Thanks, Dan. I think just a few things that I was struck by. You talk a little bit about there's a willingness, which is great to hear. And I think around the world, Sweden's known as kind of having thought about integrated care for a while. So there's a lot to learn across borders, because I think what we see is the direction of travel is similar given what we're having. So it's great to hear that there's that willingness. But how do you, we have a saying in English, pump prime the innovation. How do you kind of get started, right? Where do you have that innovation funding from? And I'm so glad to hear you talk about not only funding the technology itself, but the change management, not only for the staff, but for the end users, right? I think one of the things that's critical in our industry is we're the experts in how this technology gets used by end users. I think we've all tried to put an Alexa in someone's home, and these are hard technologies to get to know. And so how do we think about how to adapting them for that end user base? So a lot of great thoughts there. Laurent, I'm curious your perspective on that funding challenge. And I know in terms of kind of those grants, you look to European funding as one way to get started on this innovation. Can you tell us more about that and kind of other thoughts as we make this transition from reactive to proactive?
Yeah, in terms of funding, well, I think nobody has a magic wand to solve the issue. And of course, complexity is that if you look at the global value chain, you have costs at some point, but you have benefits at other points. So it's kind of hard to make sure to align everyone and go in the same direction. The project that I talked about previously with the sensors and AI is funded by the EU. It was part of the resilience plan after COVID. So we were fortunate enough to be selected. And honestly, without that grant, we could not have launched the project because it's quite expensive. And we need, of course, we need the hardware, but we also need, as Dan said, having the right people to do the change management and to work on that and manage that. So without that grant, it would have been impossible. But on the other hand, I think that we should also rely on ourselves and our creativity. So there are two things that I would like to say. The first one is that in my structure, I try to have like self-funded benefits that will pay back an investment in maybe something else. For instance, if with technology I can improve the way a nurse will take care of someone, I will work on my own little value chain and making sure that I have a balance on that. I mean, of course, I cannot run lots of projects, but I can still start with something little. And then, if you want to go bigger, we had a collaboration with a major Belgian insurance company who was also interested, because if you provide more telecare, you can limit the number of days in hospitals, and as insurance pay, I would say, the difference between what Social Security gives back to the patient and I mean, the insurance pays the difference. If it has to pay less, insurance companies are interested. So I would say, looking on the whole value chain, trying to see if you can make cooperations with others and develop small projects that can maybe be a first step to something bigger. That's how I would work, because otherwise you're like, okay, I cannot do it, it's expensive, I won't do it. So I'm more like, okay, how do we do it, instead of why is it complicated to do it?
Love it. And I have a phrase here: think big, start small. And I think you really kind of embody that. And I think one of the things you mentioned is, how do you start within your own value chain, and how do you find the more efficient and effective ways of working for whatever your business model is as first part of call. Kevin, I know that's something you're thinking a lot about. Can you comment on that in Radius?
Yeah, there's a whole lot there, and the focus on cost worries me sometimes, because we should focus on value. We should focus on looking at this as an investment opportunity. I mean, Northern Ireland has just got its draft programme of government issued for consultation, and it boldly states that there isn't enough funding for the services to meet the current needs of people. Yet on the other hand, it sets an objective of reform and transformation. Now, because we don't do change anymore, we do transformation, because that's what's needed. It's got so bad. But they have set money aside for what they call a transformation fund, and it's really key that that's spent wisely. And I think supporting change management is where funds should be invested, because at the end of the day, you're trying to change a service delivery model which must be funded mainstream in due course. So pump priming things is important, as long as there's a goal, but like our speakers have said, of becoming self-sustaining down the line. So that's on the one hand, and I think, I mean, even Lord Darcy, when he did his report, and then he did an opinion piece which suggested that a policy solution to the crisis is that it has to cut across all government policy, and he talked about making healthy life expectancy central to government policy, and suggested a goal of increasing healthy life expectancy by 10 years to 2055 to focus minds on what can you do differently to achieve that goal, put some practicality into this so that people see value. Part of that has to be the development of a more mixed economy. I mean, we're seeing the same money coming from health and social care as we've always done, and I'm looking for that to be stretched further. To build the capacity to cope. And at the same time, for our core services, we're seeing consumer demand accelerate because people see the value in such a service. So, I mean, government have a real role to do in terms of public awareness. You know, you've got climate change, obesity management, the crisis in health and social care is right up there. And let's keep talking about social care as well. And let's not just have warm words, let's put some funding into that as well, rather than health swallowing it all. So it's a core challenge, but you know, starting small locally within your own communities and networks and seeing what you can do. We found that mixed approach works well, between the consumer-driven models and then the social care and health-driven models. And it's a blended model, really, we have of funding, a blended service delivery model. But it's all about building the capacity to cope. There'll be no cost savings. The demand keeps going up, so it's about being wiser with targeted funding.
Sometimes the cost savings are about avoiding the need to build the number of hospitals that we're going to need in the future. And I think, you know, one thing that really comes across in what all of you are talking about is how do you think big, but kind of make those first steps? And you mentioned, Kevin, right at the very beginning, how do we create that urgency? I think the good news to a certain degree is we're seeing more commonality of that urgency across borders. But one of the real reasons we're facilitating this conversation is I think we can learn how this is working, how funding is being made, what those outcomes are, to accelerate the collective innovation as opposed to every service or every country trying to prove out these use cases on their own. So thank you all for sharing that, but that's part of what we're hoping to be able to stimulate here. And that's true of funding, which is one of the risks of being able to innovate in this space. But I think you all are already identifying some others, especially when we talk about change management. And I'm hopeful that by talking about those risks of what's going to make kind of this transformation of telecare really happen, we can unearth them and make plans for them together as part of a kind of industry. So I'd love to hear, what are those risks in being able to really innovate and scale that innovation? Because so often we start pilots that don't wind up scaling. And how do you think we can be thinking ahead of those risks in the pilot projects that we're working on to accelerate the ability for this innovation to scale? Kevin, do you want to start?
Yeah, to me, I go back to one of the points I made earlier, in terms of building upon existing established network of service delivery in an incremental way. I mean, the real risk is the failure to exploit the opportunity to build on that. You know, so investment in the sort of tech services Radius Connect 24 deliver should be seen as manna from heaven for health and social care professionals, that they have this expert frontline, first line triage type service, which is already filtering demand to the acute sector in terms of the acute demand management. Many centres, 95% of calls resolved without escalation onwards to emergency services. Take that model, take that principle, apply it upstream in terms of the preventative agenda, and you can do so much more, and you can actually mobilize and support the army of informal carers better to deliver care to people at home. You know, the real risk is the fear that the data if it's not information, it could potentially expose current latent demand for service, and the unintended consequences of raising anxiety and creating the new cohort of the worried well.
Mm-hmm.
So services such as ourselves are already in prime position to manage those risks, build those services, and deliver into the future. So bringing the tech sector front and center as a core underpinning service, it's really our time.
I love that, Kevin. I think we have these assets in place, and how do we be part of this solution? Because we're there when people need us 24/7, but that also helps support the wider health and care service. I think that's really helpful. Dan, what are your thoughts on kind of those risks and how you're thinking about them?
Well, like being said, we addressed some of these questions earlier, but I like the word value chain that Laurent used before. If we first and foremost recognize the internal value chain, that's a great way to start. And here in Sweden, when we are introducing new technology, there's also, of course, a lot of legal issues and that needs to be addressed, and one of them is the question of consent. But that's usually, of course, not usually. It needs to be included in the routine. And secondly, or how to address or mitigating these risks. In one way or the other, we need to address the fear of changing, like we talked about earlier. Both for the personnel and the end user, of course. And one issue here that's often addressed is the fear of missing out on the human connection. And as we've said before, I don't think that's the aim for the technology. It's rather a complement, so that we can work more efficient and smarter, and you can be more self-independent in your daily life. And another fear that's kind of common is the availability of the technical solution, and people or personnel, they tend to lack the perspective of having fallback routines, at least in their own mindsets. These routines, they exist on paper anyway, in many of the times. And they also tend to forget that the former routine or the way of working yesterday wasn't flawless as well. So you need to keep in mind two thoughts at the same time to be able to, again, address your own mindset and your feelings and your thinking about the new way of working. And another way to address this is to, when someone is experiencing new tech, we need, of course, to follow up and listen to the participants. We need to address the questions that they are having, and we also need to highlight successful introductions when self-independence is becoming better when using new tech. I think a good example of that is we have, on a broad basis, introduced medical dispensers here in Jönköping, and we have had many examples of people being able to be more flexible during their daily life because they could address the issue of taking the medicine pills themselves rather than a caretaker coming to their home and helping them with that. So that's and also here I think we should if we can be better to address these examples to media, which is tough. Because I mean, the trends now that we see is we're reading about catastrophes and traumas and the worst things in life that are happening. We are not reading about these positive things to the extent that we. I think we should need to be able to change our own mindsets. It's difficult in these days.
I love that. How do we shape that narrative together? Laurent, we're starting to get questions in the poll, and I encourage all of our participants, if you have questions, we're starting to enter into that Q&A bit. Kind of in building in this question, one of the questions we have in the Q&A is, how are you working with your end users in this process of introducing more advanced and innovative technology? Do you have any lessons learned from that?
Take time, listen, go and talk to them, understand their reality. There's no magic formula. It just takes time and understand our user. The good thing is that we have our people that are at the user's home every day, all the time. So we start to know them. But for instance, it's a small and kind of stupid example, but one of the technology that we tried and we put at people's place was like this AI stuff. There is this I would say bulk. I don't know. It's like a modem that connects everything, but it also gives the time of the day, the date, and sometimes you can ask the temperature. It's not nothing really complicated. Some people love it because it's like, oh yeah, I feel like I'm not alone at my place. There is something that talks to me, and sometimes I'm sure that if I wake up in the middle of the night, I know it's still in the night, and so on. Some people hate it because like, oh no, I'm at my place. What's this technology talking to me? So there is no like one good or one bad thing. It's just that you go, you talk to them, you explain them what it can bring, what it cannot bring also, and then you let them decide what they want. And usually, most of the time it works. People say, okay, I understand it. Okay, so you tell me I'm not going to be spied? No, you're not going to be spied because that. Okay, well, I see what's in it for me, and then I will go for it. But as simple as that, doesn't mean that we succeed all the time. We need to stay humble on that.
I think that mindset of what's in it for me is a core part of change management, whether that be for the end users or for our care workers, kind of knowing that we're going to have the answer to that question as soon as we start this process, and being able to change how we explain things for those different stakeholders, right? Being able to really understand what's in it for me from various perspectives, I think is really valuable. Kind of thoughts, Kevin, Dan, any questions you all have for each other, kind of hearing the conversation so far?
I can. You didn't ask me, but so I will I'll give them time to think about their question. There's something I wanted to add to the risks, because I think one of the risks is also not having the right people managing those kind of projects, because basically we are in the care sector, and the care sector is not really known for having, and I'm putting myself in it, innovators running those companies. You have more human people running the companies, not always taking risks. I mean, everything needs to be well prepared, well balanced. And here it's like a big shift. It's like you're running a new company with lots of digital stuff behind that. And I think it's important that the leaders have the right mindset to say, okay, I'm taking a risk. I'm doing something totally brand new. I'm gonna fail sometimes, and I accept that, because if you don't have those people managing those projects, those leaders will only see the problems and not the opportunities around it.
Yeah, I agree, and as a compliment from the public sector, we need to address the. We need to dare more, I think, and one perspective that is, I think, as I mentioned before, how do we need to look at how we're organizing stuff, and that takes courage to dare to change a structure that has been used for many years.
Mm-hmm. Courage is a big part of this, right? How do we kind of get the wherewithal? And I like what you were saying before about what we can do as an industry to really shape that narrative. And the hope is, by bringing together the community, we help build that courage, right? Because we all kind of see that the future's headed in the same direction, and so we can kind of build that future together. Kevin, what one piece of advice would you have for people who are interested in this but thinking of getting on the journey? What's been the most successful way you've been able to create that urgency you spoke about earlier in the conversation?
Yeah, I think recognizing that the biggest learning comes from doing the thing rather than there's only so much desktop research and planning you can do. You need to get on with it and try it and implement it and be willing to learn and recognize that that's what it's about. It's about learning and adapting and tailoring the model as you go, and not waiting for perfection. I suppose that's the key. And you know, in the health and social care world, it is inherently risk averse, but we're talking about improving people's lives and making a difference, which is better than they are today. So are they better off having this attempt at something than not having it? Yes, inevitably they will be. So just get on with it would be my words of advice and encouragement.
No, it's great. We have a question from the audience. It says, how can we best embrace technology to improve independence, but retain vital face-to-face contact with end users? Laurent, you want to take a stab at that one, given I know you have kind of a lot of face-to-face people in your teams?
Yeah, well, it's not technology or face-to-face. It's technology for a better face-to-face, basically. It's just that if you have more insights and more data and more intelligence about how a person is living, when you are face-to-face, you will be able to provide to this person better care, better information, and work better with the person. So, and as I said, I think that's typically something that people have in mind, technology instead of human interface, but it's not going to be the case because there's not even enough human to have the interface. So no, that's something that shouldn't be a real issue, but is somehow in the in unconsciousness of the people.
Yeah, I think that's really interesting. I'm curious as we focus, I think, one of the things that we've learned that really enables this transformation is a focus on demonstrating outcomes, right? We'll all have to prove out through pilots the benefits and then be able to make those business cases to scale this innovation. Are there one or two outcomes that each of you think are most important to think about, whether they be for the end user, for your operation, or for the wider health and care system that you think we should all really focus in on?
Yeah, I think that's a tricky one because different people are looking for different outcomes, and it depends on the audience which ones you emphasize.
Mm-hmm.
To me, we're in the people industry, so the focus must always be on, is this person feel better supported, more confident living at home with this service than without it, with this tech than without it. So I think we've got to be real grounded and rooted in that. I go back to, the value of the consumer, and if the consumer sees value in what you're doing, then you're getting something right, which you can build upon. So to me, it's I always think, this the mixed economy. Would you be willing to choose this service? Would you be willing, if you're able to pay for this service? Would you have this service for your mother, father, whatever? That's keep that at the heart of all your thinking, I think, and then the other dividends become clear and stack up.
Yeah, I totally agree. I think we always need to start from the individual perspective, but also we must not forget that actually some people actually prefer the digital solution before being helped at home as we used to. So that's also a big key in this.
I agree, but I'm not too naive, unfortunately. Oh. And I believe that even though, of course, the base is okay, is the person going to feel better with than without? Eventually, at the end of the day, somehow we need to be able to transform this better situation into either days at home instead days of hospital, or days at home of at retirement places, or less nurses coming to the people's home or something like that, because otherwise, even with the best project or the best idea, we won't be able to get it funded and to convince, I would say, stakeholders. So,
Yeah.
of
I think
course,
you're right.
this is the basis, but we need to look and to try to figure out how to transform that into, I would say, hard KPI effects to be able to sell it afterwards, because otherwise it's going to be hard.
Right. Well, I think that's a great note to end on, because I think having the end user at the center of everything we do is what unifies us, right? And I think what unifies our industry, because we can think about that end user, but we all know in order to make the change we need to connect that end user independence to real outcomes for the wider health and care system. And by sharing together, I think we have a real opportunity to accelerate that narrative. So thank you all for joining us. We hope to continue these global conversations. So we are planning one right now with 3 panelists from Spain, where they have a very proactive and increasingly predictive model of telecare. And so we'll explore together how they're doing that within their context in Spain. We'll send a survey out. We'd love your feedback as we prepare for the next set of global conversations. But please join me in thanking our panelists, because I think it was a great conversation. So very full of gratitude, Laurent, Dan, and Kevin. Thanks for sharing your expertise and being a part of the conversation.
Thank you.
Thank
Thanks
you.
for the invitation. Thanks. Bye-bye.